the VAM for DaVita Dialysis. I'm the Vascular Access Manager, and I am here to talk to y'all today about getting the catheters out of your chest and getting a fistula or a graft in your arm to help prolong your life. The best option is going to be the AV fistula. That is the preferred standard way as of DaVita. Another option is a graft, but I'm going to explain both of them to you. First off, catheters have a much higher infection rate than an AV fistula or an AV graft. You or someone you know could be at risk, so it's really important that you learn these things and figure out what is best for you. A catheter has decreased clearances, which means basically that your blood's not being cleaned well, so you're not going to feel good as you would if you had a fistula in your arm. Also, it has a high infection rate. You are 35 times more likely to get an infection with a catheter. It's a direct line to your heart, so any type of infection that you get will go directly to your heart. And you are 3 times more likely to die with a catheter in your heart. Also, with the high increased rate for infections, you're more likely to be in the hospital. The reason that we want to do the fistula first is because it's where the doctor goes in and he actually cuts an artery and a vein in your arm, either here or here. He takes the artery and he sews it to your vein, and then it comes up above the skin a little bit, but not bad, so that it doesn't really cause too much disfiguration. And once that happens, it takes about 6 weeks for the fistula to mature, and you're able to cannulate it with 2 different needles. After 2 weeks prior to the surgery, after the surgery, you will need to start exercising it with a 3 to 5 pound weight or squeezing a ball that we'll provide for y'all. That helps the maturing process. And then, like I said, 6 weeks later, we will cannulate the fistula with the 17 gauge needles. After 3 cannulations, we will then move the needle size up to a 16 gauge where your blood flow rate can be 350. What that does is it's going to let your blood be cleaned better, which means you're going to feel better, you're going to be healthier, you're not going to have that foreign catheter in your chest, so you're less likely to have infection, and that's also the chance to get your time decreased. That way you won't be on the machine as long, so you can have more time outside of dialysis with your family, with your friends. If you have a job, you'll be able to work more hours. So it's really something that you want to take into consideration when making this decision. I know that it can be really scary to think about having needles stuck in your arm, but also most insurances will cover lidocaine cream. And what you do is you just apply the cream to your fistula. In the general area, we'll let you know where we're going to cannulate you. You put it on there, you don't rub it in, you just put it on top, and you wrap it with some saran wrap an hour before treatment, and then when you get there, you wash it off, and then your arm is numb. So it's not as bad as you would think, actually. And also, DaVita has a program called Expert Cannulators, which means everyone that is going to cannulate your arms actually has taken classes, and they're qualified to do this, so you don't have to worry about someone coming in with no experience hurting you or risking damaging your fistula. Another thing is the AV graft. That is the second option that we prefer. Like I said before, fistula first, always. But a graft is where they will take an artery and they'll cut your arm either here or here, in your leg, or even the necklace in your chest. And what that is they put an artificial tube in your arm, connect it to the artery, and it'll mostly be a loop graft. Now, we don't like this because we don't prefer this, I should say, because it's still a tubing. So it's an artificial piece of something in your arm, so it will be more prone to infection as the catheter, but not as bad. So we kind of try to stay away from that. One of the good points of the graft, though, is that the special new graft they have called AccuSeal, it actually, you can cannulate it 24 hours after it is put in the body, and then upon 3rd cannulation, you can remove the catheter. So doctors like to do that, and we will resort to it if a patient's veins are not large enough. And another thing is the graft, the other graft that we do, not the AccuSeal, just the regular graft, the loop graft, you'll have the venous on one side, the arterial on the other. and you can go straight to 15 gauge needles after that, and that way, you know, you can get the catheter out not as fast as the AccuSeal, but faster than the fistula, so that's pretty important. Also, we have villageweb.davita.com that can give you information on either having the fistula or the graft put in. We have a Calfway program that's really interesting for people. We try to educate you and let you know what's out there for you. Does anyone have any questions?
Which access do you prefer? In
Well,
your opinion?
That's a really good question. Of course, I'm fistula first because of the infection rate and all of those things, and also just that it's something in your own body. It's your own vein and your own artery that can grow, and with that's what you want. You don't want to put anything foreign in your body. I would personally not want anything foreign in my body if I can help it. And also we can, with the fistula, we can do buttonholes where the bottom stick and the top stick, you go in the same place every time with a sharp needle for 3 times, and then after that it develops a tract. So you have your ears pierced?
Yes.
Okay, so it would be just like putting an earring in your ear. It develops scar tissue after a certain amount of time, so then you begin cannulating the arm with a dull needle after you pick the scab over. You stick the needle in just like you stick your earring in the hole, and you don't really feel it. They say the worst part is picking the scab. So I would prefer to have a fistula and have a buttonhole. There's not going to be tracts all up and down your arm. It's just 2 little holes that you don't really feel that much. So I hope this has been educational for y'all. And if you have any questions, we can get together afterwards, and I'm going to give you all some websites to help you look this up to discuss with your families and with other people that you know.